Good afternoon from cloudy Reading, from my office in the Psychology Building on the lovely White Knights campus. I'm Dr. Aileen Ho. I'm a member of academic staff in the School of Psychology, and I'm also the school employability lead. Today, I'm also your host for this Psychology Centenary event on pathways to supporting well-being, careers for people who care. I'd like to start by warmly welcoming each and every one of you, wherever you may be right now. Thank you for joining us online as we celebrate 100 years of teaching and training in psychology as one of the very oldest psychology departments in the land. And I'm incredibly proud to be part of this great tradition of providing excellent training alongside research. And I'm sure we'll continue to do so for the next 100 years plus to come. Now, although we may not have originally envisaged celebrating our 100th birthday as a remote online event, on reflection, I do think there is something strangely apt in that we're doing so in a totally new way that's entirely different from how our predecessors would have done so 100 years ago. So I can see that we do have over 100 people registered for this event. And I would like to kick this event off right now by outlining how this 90-minute session will run. First, we will invite our distinguished panel from 4 different professional psychology fields to tell us as much as they can about their career story in the time allocated. And then we will have a short time for questions after each panelist. Please use the Q&A box for questions to the panelists at any time during the session. You can also react to these questions by liking them if you'd really like to see them answered. The Q&A box will be moderated by our fantastic student partner team comprising of our students Dennis Persicini, Natasha Lazarev, and also Emily Holding. We will then have a short break at 5 p.m. and after this we will come back together again for a panel discussion on careers in mental health and also care in the post-pandemic era. Right, now on to our very first panelist, Dr. Mallika Sharma. Mallika has been a senior cognitive behavioral therapist with Talking Therapies at NHS Berkshire for 8 years. And she also teaches on the IAT CBT course within the school's Charlie Waller Institute. She was born in India and was on track to be a mathematician before switching to training in psychology to follow her passion for helping others. She emigrated to the UK when she got married and was actually one of my master's students just over 10 years ago. So it is my great pleasure to invite Mallika to tell us her career story.
Thank you very much, Aileen. It's my pleasure to be on this panel. I hope people will find my career journey a bit inspirational, as it's slightly different to the normal routine one, which we get to hear here in this part of the world. So, as Aileen already mentioned, that I was trying to do my graduate with mathematics and psychology, and I was thinking, why did I actually choose psychology at that point? So my college was offering a few subjects at that time to put in line with mathematics curriculum, and it was literally just by ruling out all the other subjects I wasn't interested in, to be honest. So psychology looked a bit interesting, and that's how I started my journey, not knowing exactly what I wanted to do with my degree, which some of the graduate students might find themselves, and they will be identify themselves that they were not so sure when they started the degree. But by the time I finished my graduation, this became pretty clear to me that mathematics is not the career option I would choose, as I was keen to choose a career to support people, to be with others, to make myself worthwhile and make a difference in other people's life. And that's the reason why I decided to do my master's in psychology, and then I got interested in clinical psychology. at that point, you can imagine there was a huge stigma about mental health. So I received a lot of discouragement, you can say, from family, from friends, thinking about what sort of a career you are going to go ahead with. This sort of profession, despite coming from a very educational family background, nobody has ever adopted. Nobody ever knew what does it mean to be a psychologist. So having absolutely no support in the direction of this career, I was one of the very fortunate one to be on a clinical psychology program, because at that time in India, it was very limited. Only 3 institutions throughout India were offering 30 seats, which means 10 seats per course. So I was very fortunate to be on one of those courses. And I finished my clinical psychology training. I worked there for a while in India, and then I got married, moved to the UK. Then I decided to take a career break, mainly because of the reason I wanted to acclimatize myself to the language, the culture here. And I could never think of being able to work in a completely different country where the language and the culture are very different to mine. So I decided to take that time off from my career and spend that time with the family, acclimatizing myself with the country and the culture, and thoroughly enjoyed that period. Then my first step back into my career was when I was a student of Aileen, and I was always interested in doing further research. So that led me to MSc in research methodology in psychology. And that was a very interesting course. I enjoyed, and at that time I was offered a voluntary position at one of the clinics run by the department, which made me more and more interested in CBT. And that led me to another degree. I did a master's in CBT at that point, and even before finishing, I was offered a position within NHS to be a CBT therapist. So, and following that, I've done my PhD in psychology, mainly looking at the efficacy of culturally adapted CBT in depression and generalized anxiety. So that's how my career has been so far. And I've thoroughly enjoyed. The reason why I moved from clinical psychology to CBT, I felt being a CBT therapist, the sense of achievement of helping other people was more than being a clinical psychologist and just diagnosing people. I felt this is very much like labeling people rather than supporting them. So that led me to be more in the primary care rather than secondary care. And I'm thoroughly enjoying my experience. Now I'm teaching CBT. It's a wonderful profession to be in, very satisfying, self-satisfying, I would say. You don't need your manager or anybody else to give you a clap. Your clients are going to give you all that feeling of accomplishment that you are making a difference to someone's life. So I've thoroughly enjoyed myself. So that's my career journey.
That's great, Mallika. Do you have you come across any misperceptions of what a CBT therapist has been, or did you have any unrealistic expectations perhaps on what the role entails now that you are what you wanted to be?
Yes, I suppose so. So some misperceptions from family and friends, their expectations on you to be in that psychologist mode all the time, every time they speak to you. Their misperception might be that you should be able to handle your stress and your emotions all the time. To be honest, that's not true, because at the end of the day, we are human beings. Just by knowing that techniques doesn't help us. We also have to apply, and sometimes we need that help. And I get to see a lot of trainees being in quite a stressful course, but not realizing that they also need help. So that would be my message, to put ourselves in that client's shoe and that would really help you to get through, because just being a psychologist doesn't completely rule out that you don't need help. We are, at the end of the day, we are human beings and we also need help.
Absolutely. Yeah. And Mallika, what would you say was the biggest challenge you faced in pursuing your career as a CBT therapist?
As a CBT therapist, I think it's a very challenging course. You are juggling between the two, between the academic world at the university and at the same time doing placements, or if you are employed by NHS. And that's the balance when your university assignments are due, but your clients are not turning up. I'm having that going side by side. That was the biggest challenge for me to do the training. And several times you would need to apply for the extenuating circumstances form just because your client decided not to go ahead, or something went wrong with them, or something else did not go as you planned. So your assignments, just like an academic course, when I did research methods in psychology at Reading, all my assignments would go in time because they are not client based. So the biggest challenge with the CBT course is all the assignments are client based. So the control is not in your hand entirely, and that was the challenge.
I just see a question here that's been posted for you, Mallika, so I'm just going to read it out to you. The question's asking if you're restricted to a set number of sessions with patients, or do you have freedom to do as many sessions as is clinically needed?
These sessions are guided numbers of sessions. Of course, I've always felt free to fiddle around with the numbers according to the client. I've never been felt any restrictions.
Okay, right. I hope that answers the question. Do feel free to pop in any other questions for Mallika as well. Mallika, I was wondering if you could just maybe take us through a typical day of yours in your role, and give us a flavour of what it's like of a day in the life. Mallika, is that okay?
Yes, that's absolutely fine. So a day in NHS setting would be 1 or 2, 3, depending on your working hours. One thing I would say, I have been exceptionally supported with flexible working as a mother of 3 kids. So I could fiddle around when I see my clients. You've got a set number of clients you would be seeing in 1 week, and I could fiddle around that. So certain numbers of assessments you would be doing every week, but majority of your workload would be, of course, doing the therapy. And apart from that, there is a bit of paperwork. There is also what is hidden sort of work is to do a little bit more of the admin if you have to do a referral to another service, or if your client has become has been on risk and the risk is increasing, you can't manage. So all that is kind of like hidden, which normally no course teaches you, but of course that's part of your job. Doing all that admin tasks, following up with the GP or the midwife, talking to other professionals. So in a way it's good because you work as a team, but that takes up quite a lot of time to write down and do that academic work. Being a teacher, of course, is lots of teaching, supervision, marking, and academic tutoring. That's usual to any course, I suppose. That's my day.
Fabulous. I've just got another couple of questions quickly for you. Is there such a thing, Mallika, as being too late to begin this kind of career? Absolutely
not. We have got some students who, and also I had the classmates who were learning CBT at the age of 60. So it's never too late for a good cause, for anything, I suppose, not just for CBT, for anything.
Yeah, okay. Another question here about whether you've had to transition to delivering sessions virtually because of COVID, and if so, how have you found it, and how have your patients found it as well?
Yes, that's interesting question. I was sort of naturally felt that I was ready for COVID in a way, which is a strange story. I was operated on both the shoulders, one after the other, within a space of 3 months, just before COVID, back in August 19. And at that point, I'm one of those people who can't sit with the pain. So after a couple of weeks being at home, I called my manager and I said, I can't sit with this. I have to do something. I can't be sitting with the pain. Otherwise, I focus on my pain so much. And as a CBT therapist, my own therapy would be carry on working. So me and another therapist who was finding it difficult to travel to work, we both started working online. So in a way, naturally, we were prepared. At that point, we did not have any help. We did not know what to do, but two of us together made our way through. And then there were a lot of webinars done by our organization and outside the organization. We all attended those trainings. Another research trial I worked on with Oxford University a year before pandemic was on social anxiety, how to do therapy online. And to be honest, I was in a very skeptical mind, how to do this. Have they gone crazy? But trust me, that did work. And so I was kind of like ready for the pandemic, not expecting that the pandemic would happen. But of course, this was need of the hour.
Sure, fabulous. Thank you very much, Mallika. Now, please join me virtually and otherwise to give a hand to Mallika and to thank her for sharing her experiences with her. Thank you. Our next speaker is Dr. Claire Willis. Claire hails more locally, just down the road from West Sussex, and after her undergraduate psychology degree, she undertook a 6-month stint in rural Tanzania, helping to build primary school and community health education premises. This motivation to directly help people in a very hands-on and applied way has led to a clinical career as a CBT therapist and also health psychologist at the South London and Maudsley NHS Foundation Trust, working with complex patients who have medically unexplained symptoms such as chronic fatigue, fibromyalgia, and also in more recent times, long COVID. She too teaches on the IAPT CBT course within the school's Charlie Waller Institute. Over to you, Claire.
Thank you very much, Aileen, for your introduction. So really, just to continue the story, so from Tanzania, after I completed building these primary schools and doing this health project, I went to climb Kilimanjaro, so I was lucky enough to get to the summit, which was very enjoyable, and then had an opportunity really to relax after all my hard work on the beaches of Zanzibar. So this really gave me an opportunity to reflect and think back to, what I'd enjoyed in my undergraduate psychology degree, and to think about, what would be my next career move. So I recall that I really enjoyed a module I took in psychoneuroimmunology, which is a little bit of a mouthful, but essentially means the relationship between psychological factors and the response of the immune systems and nervous system. So I was really fascinated by the mind-body relationship. And again, I also knew that I wanted to work in an applied way. So I had a look at a couple of career websites and the British Psychological Society, and spoke to a health psychologist, and I realised that a master's in health psychology would be the most appropriate way to explore these areas further. So essentially, a master's is the first stage in the route to becoming an applied practitioner health psychologist. So I enrolled at Staffordshire University, and I was very lucky at the time to get a paid placement. So I started working in a community healthy living centre, as they were known at the time, and I was responsible for evaluating health outcomes for a range of activities at the centre. So things like exercise, arts and crafts classes, general sort of well-being and health education as well. And I realised that I really enjoyed, being able to work and interact directly with people. and really just seeing the difference that these activities were making to people's lives. So this furthered my desire to continue in the more applied route rather than academic and getting a PhD, which is potentially another way that you could work in health psychology, which is more research based. But again, I knew that I wanted to work with people on an individual level and also at the community and population levels, which I think health psychology is really well placed to do that. So that really led me to working initially in public health. So I started working in primary care, where I started to develop health profiles and assess the needs of the local population for chronic diseases such as diabetes and heart disease, etc. And again, I was involved directly with patients, interviewing them for some qualitative semi-structured interviews to inform these profiles. And I really became aware of the importance of including patients in, decisions about their care, and really hearing about the patient's voice and their involvement in communicating with health professionals, and the kind of impact that can actually have for people. So this really led me down to London, where I started to work again in an applied way at University College London Hospital. And so I was really working in roles to improve quality and safety for patients, and also in patient and public engagement. So I also got involved in doing some training for health professionals, trying to look at communication skills, again thinking about how the patient is going to receive their care and communication, and how that's going to impact on their experience. So that was very interesting, and one of the projects that I happened to get involved was looking at trying to identify how many patients in the trust across all the hospitals had comorbid depression with their chronic diseases, so that we could look at trying to help people in more of an integrated way, looking at their mental health, which quite often with long-term conditions can be quite a comorbid problem that occurs. So this really led me to working with psychiatrists and psychologists who worked with patients with medically unexplained symptoms, and so this really reignited my interest, I think, in the mind and body relationship. And so again, I became very fascinated by this, and was talking to the psychiatrists and psychologists and thinking, how can I work in this field now as well. So they suggested to me the best way would be to take a course in cognitive behavioural psychotherapy. So I took their advice and enrolled in a postgraduate diploma. So again, I was lucky enough to have a placement with that team, and I also continued my paid work in patient involvement at the hospital as well. So that was very enjoyable, and I learned a lot. But unfortunately, by the time I graduated, there weren't any paid opportunities at the hospital. So I did some work in primary care in the improving access to psychological therapies services. So I did a couple of years really working across the range of mental health problems. So I got quite a good ground in working in CBT. And then, as if by magic, a post came up to work with medically unexplained symptoms at the South London Worsley, and this was really to work as a trial therapist, so that we could evaluate the effectiveness of CBT for this patient population. So that was very exciting, and I was offered the job, and I started working clinically. And we also had the opportunity to do some teaching and training, so to provide sort of basic conversational skills, based on cognitive behavioural principles for other health professionals, GPs, physiotherapists, occupational therapists, nurses, etc., so that could sort of like facilitate their interactions with patients in secondary care. I was also working amongst health psychologists at King's College London, and I realised that the skills I was developing really fitted quite well with the competencies for the Stage 2 qualification in health psychology. So essentially to become a practitioner health psychologist and to get a professional doctorate. So these competencies are behavioural change, research, teaching and training, and also consultancy. So I enrolled in that doctorate while I was doing the trial work. So this was at City University London that I did the doctorate. So I'd say this was quite challenging, and you know, I would advise that it's not to be taken lightly, and you do need good organisation skills to manage your time. So, but at the end of the day, it definitely was worth it. So I would recommend that. So now I'm really continuing to work in this sort of profile way. I continue my clinical work at the South London and Maudsley, and as Aileen mentioned, I'm also working with long COVID patients now. So I've had the opportunity to work closely in multidisciplinary teams with respiratory consultants, physiotherapists, occupational therapists, really to triage and assess patients so that we can, you know, get the right services for them. So again, that's been very interesting and rewarding work. And then really I've been continuing my teaching and training part of the competencies, and recently joined the Charlie Waller Institute at Reading. So I've just been with them for a couple of months, but really working with a great team of lecturers again to teach trainee CBT therapists. And my focus is really around long-term conditions and complex conditions as well. So I think really just to conclude, I think I probably followed a slightly less traditional career route, but have managed to combine my interests of working in an applied way and also my interest in the mind and body relationship. So finally, I think maybe some last advice is that it pays to follow your interests and to reflect, you know, possibly if you've got the opportunity up a mountain or perhaps on some lovely beaches somewhere as well. Thank you.
Thank you very much, Claire. That's lovely. That's lovely. I see we do have some questions in the box. So Nick has also very kindly put up a link here that Claire has passed on the pathways on how to become a health psychologist. The question that we have here, with quite a few likes, is about what kind of work experience you would recommend, Claire, for those interested in your role, and what advice do you have for them?
Yes, so I suppose, you know, a bit like myself, you know, perhaps working in a community sort of like health centre, or sometimes there are some ways in via primary care in public health. So that could be one way to get some experience. So I mean, you might be lucky enough to get a paid placement or doing some voluntary work. Possibly another route in might be working as a PWP if you're working with long-term conditions. That could give you some insight and experience as well, I think.
Fabulous, fabulous, brilliant. So I think there's another question here. If I could invite my moderators, Dennis, to read out the question, because I can't quite seem to see it on mine because I'm having problems scrolling down my question and answer box.
Yeah, sure. Yeah, so the question is, have you been training individuals for CBT online? If so, how do you think it has been received as opposed to training in person? So I think the difference between online and in-person training.
Yes, thank you. Yes, yes, I have been doing several courses online actually, so I feel like I'm quite experienced in it now over a year. So I think, yeah, initially people didn't receive it quite so well, because I remember I was teaching face-to-face at the time, and you know, everyone really preferred to have that kind of face-to-face interaction. So it was a little bit odd, but I think people, you know, did kind of get used to it, and I think, you know, after you kind of get over all the technical hitches of, you know, being muted or somebody can't get on, etc., you know, it can work in a reasonably good way. I think, you know, you need to probably have some good platforms, you know, where you're able to kind of see each other properly. I feel that can help, you know, rather than sort of just having a small tiny box, you know, in terms of interaction and everything. I think you need to sort of adapt it and think about, you know, sort of having regular breaks so that people don't get too tired, and how can you use breakout rooms, to facilitate the interaction. So I think there's sort of pluses and minuses around it, really. But I suppose it does also allow you to reach a wider audience. You can be teaching people all over the world. So I think that can be, quite a positive advantage for it in terms of that reach and access.
Right, lovely. Thank you, Claire. Can I invite all of us to thank Claire for her story before we move on to our third panelist?
Thank you. Thanks very much.
Right, now moving on, our third panelist is Fisayo Adunola. Fisayo was born in Nigeria and moved to the UK as a little baby, growing up in Manchester, and is now based in Essex. She's currently a second-year counselling psychology trainee at the University of East London and has been on a psychodynamic placement working at a primary care setting in the East London NHS Foundation Trust for most of last year. Alongside this, she also works as a clinical tutor in the school's Charlie Waller Institute, where she teaches on the low-intensity CBT intervention program. Over to you, Fisayo.
Thank you so much for that introduction, Aileen. So my story is a little bit different. I first became interested in psychology when I was doing my GCSEs, as we had a teacher who taught RE, sociology and psychology. And I sort of became quite interested in psychology, particularly looking at some of those theories that underpin human behaviour. And at the time, psychology was not really in the mainstream. It was more kind of pop psychology. So with shows such as Fraser and Dr. Phil, and that was sort of where I took my cue to some degree. So I later went on to take psychology as an A-level subject and really became quite fascinated with studying psychology and pursuing it as a career. Again, at the time, I didn't really know any psychologists within my community. And I guess there was a lot of hesitancy and a lot of worries that I might struggle to find work, that there would be difficulties with my career progression, because it seemed as though psychology doesn't have as much of a clear-cut route as maybe some other professions. But I was still really interested, and I found out as much information as I could find out about it. And I did find out about clinical psychology at the time. And I was really interested in getting some work experience, because I was aware that there's a bit of a bottleneck when it comes to psychology graduates being able to kind of go on successfully to being able to kind of access professional doctoral qualifications. So I studied my undergrad at Aston University because they offered a placement year, and I chose this to get the practical experience of applying the theory, the psychological theory, to clinical practice. And I worked for Birmingham and Solihull Mental Health Trust at the time, and I worked in their early intervention service. So that was a service for young people who were experiencing the early warning signs of psychosis. And I really enjoyed the experience. I was mainly around a lot of research psychologists and clinical psychologists. And I guess going on from there, I just sort of thought that my ultimate route was going to be going down the clinical psychology field. So I went on, managed to secure an assistant psychologist role pretty much after I graduated, I guess owing to the fact that I had already done the placement at during my undergrad. So I got on, was applying for the clinical doctorate, and actually had an interview shortly afterwards at University of East London, ironically. and that was for the clinical doctorate, but unfortunately at the time I did not get on. And that sort of discouraged me and made me think, actually, maybe I need to reconsider my career options. So following on from that, instead of going down the clinical psychology route, I pursued a master's degree in occupational psychology. And that was much more about organisations, and it was much more about the business side of things. And in as much as it was really interesting to sort of apply my psychological knowledge in that capacity, I found that that wasn't quite where my interest and my passion lay. So I think I had some technical difficulties there. So I went down the route of trying to look for different options in terms of going about thinking about maybe going down the improving access to psychological therapies route. And so I did the enhanced evidence-based practice training at Reading University. And that gave me a lot of experience working with children and young people. And also I was able to use that qualification to work with adults as well in adult IAP services. Following on from that, I sort of started to think, okay, and what are my options? And I still kind of felt like, okay, I do want to become a psychologist. And I happened to meet a counselling psychologist in one of the services that I was working in, which was one of the first times I had actually met a counselling psychologist. And so she encouraged me to apply for the counselling psychology doctorate. And I applied to the University of East London, and I was accepted the first time round. And as mentioned already, I'm currently in my second year, and I've really enjoyed the experience so far. I've been able to gain experience with understanding how to apply different psychotherapeutic models to clinical practice. So in my first year, I was taught CBT. Second year, I've been taught psychodynamic psychotherapy, and in my third year, I'm going to be going on to a placement which is integrative. So I'll be working more systemically, and ironically, I've actually got a placement working in an occupational health setting. So that means I'll be working with clients or working in a way that kind of maybe bridges my occupational psychology knowledge with my counselling psychology knowledge. And alongside that, I've been working, and I'm still working at the University of Reading, teaching on the low intensity CBT course. So it almost feels as though things have kind of gone full circle for me at the moment. And I'm really excited about the possibility of working with a range of clients with different difficulties, and using a more humanistic approach in my work.
Fabulous, thank you. Just looking at the Q&A, we have a question for you, which I'd like to pose for you, Fisayo. Do you have any advice for students who wish to pursue a clinical doctorate? The training is competitive, and students often have to face multiple rejections. Now, you didn't, I know that, but I'm sure you know of others who would have. So what would you say to them?
I would say that there are other options. I mean, I think the clinical doctorate was sort of touted as almost the only option when I was an undergraduate. And don't get me wrong, it is funded by the NHS, whereas counselling doctorate is not funded by the NHS, so you have to pay for it yourself. But I guess because you're paying for it yourself, maybe it means that there's probably less, well, there's going to be less competition. And it is, you can still work in very similar settings as a clinical psychologist. So I would say keep your options open, But at the same time, if that is what your passion is and you want to go down the clinical doctorate route, you know, continue to apply. Somebody once said to me that you will get on eventually, you know, and I guess it is just a numbers game. So do as much as you can do, get as much experience as you can get. You know, I think one thing that I wish I had done was maybe gotten a wider range of experience. So doing some research, you know, doing some things in different clinical settings, because I stayed in a setting which was working with clients who had complex care needs, which was working for South London and Maudsley when I got my AP role. And I think I stayed there for too long, and that maybe had an impact on my ability to successfully obtain a clinical doctoral place. So I would say get as much experience as you can, work in as many settings as you can do. Don't limit your options and enjoy the journey. It is a journey. And I think if you are passionate about it, I would say still continue to go for it. I decided to give up on the clinical route because I faced one or two rejections, but I feel as though it's one of those courses that if when you do get on, it is worthwhile, is what people say at the end of it. So continue to pursue the clinical route if that is what you want to do, but also look at different options.
Yeah, no, that's great advice, I think. Yeah. Also, that raises the question between the differences, I guess, and of course there are similarities between the counselling route and also the clinical doctorate route. Yeah. So there's a question here asking you, how does the clinical psychology doctorate differ from the the counselling psychology doctorate differ from the clinical psychology doctorate in your view?
I think there are some key ways that they differ, but there's also some key ways that they're very similar. So with the clinical doctorate, my understanding is that you do placements it's all within the NHS because it's funded by the NHS. And B, you do clinical placements, so you do placements within like a child setting or children's setting, adult setting, older adult setting. So more working with, I guess, clinical populations. And obviously the clinical doctorate is funded, so that definitely is a big thing. Whereas with counselling psychology, you work with different psychotherapeutic modalities. So our placements are working within a setting that you are applying your CBT knowledge, working in a setting where you're applying your psychodynamic knowledge, working in a setting where you're applying maybe or using acceptance and commitment therapy, systemic therapy, gestalt therapy. Lots of different therapeutic approaches are used. And that means that you have a lot more plurality in terms of where you can work, because you're not restricted to working within a diagnosis. You can work in the private sector, the NHS, you know, and even your placements. One of my placements has been in a charity setting. One of it has been in the NHS, and I'm quite interested in working in the private sector. So you can work in a variety of different settings and with varieties of different types of difficulties. So you're not confined to working with, say, trauma or anxiety or depression. You can work with health conditions. So my placement next year is going to be working in a clinical health setting, and that will be working with clients who are experiencing workplace stress, relational difficulties within the workplace, maybe some bullying, you know, also working on a more systemic level, so looking at cultural change within the organisation. So I feel as though counselling psychology gives you a bit more flexibility, and even within the course I'm able to work whilst I'm studying, simply because of the fact that I only attend university 1 day a week. I'm not mandated to attend university 3 days a week, which I think is the case with the clinical psychology course. So with the clinical psychology course, you're in you're teaching, you're in lectures, I think 2.5 days, and on placement 2.5 days. Whereas with the counselling doctorate, you have a bit more flexibility, I guess, because you're not being paid. So you have to find a way to sort of support yourself. So therefore, it gives you room to sort of think about where you want your career trajectory to go. And it gives you different options in that sense, but obviously you're not getting paid for it. So, or you'll have to find creative ways if you want to find ways to get paid. So that's been one of the challenges of working or of doing the counselling psychology doctorate. That's what I would say. Yeah.
Well, thank you very much, Fisayo, for sharing with us. And that question nicely leads us from counselling psychology into clinical psychology. And so now I'd like to introduce our fourth panelist, lastly but not least, of course, who is Dr. Ceri Lyck Bowen. Ceri was born in Essex and is a consultant clinical psychologist with the Berkshire Healthcare Trust's Access and Urgent Care Services. Ceri tells me that he's passionate about innovation in practice, as there's nothing he dislikes more than an attitude of maintaining established practice, because that's just how we've done things. Something that may perhaps have stemmed from being the child of missionary parents, always on the go, is his feeling the sense of urgency to move on and to explore new ground. I'll leave him to tell you more. Let's welcome Ceri as he tells us about his career journey and how this has transpired.
Thank you, Aileen. Pleasure to be here. I'm going to split this this section into a few different areas. I'll start by saying a little bit about you know, the qualifications and the jobs I've held. So talking a little bit about the path, and then I'll say a little bit more about what it is we do as clinical psychologists and applied psychologists working in health. So a few more general points there, and then I will move to, if you like, say a little bit about what led me into the career. A few things that a few reflections about that, and also a little bit how I got to this point as well. So yeah, and there's quite a lot of parallels with the earlier speakers and things that we can I think compare and contrast at you know, maybe after the break. So I mean, in terms of qualifications, I took a fairly standard route initially, which was to do a Bachelor of Science undergraduate degree. Did that in Newcastle upon Tyne, actually. And staying in the north of England, I did some assistant psychology roles, and then was fortunate enough to be accepted on the Doctorate of Clinical Psychology at Leeds University. And that was 20 years ago now. I think one of the things that stayed with me throughout my career is a kind of, if you like, you know, a wish to kind of move between clinical and more academic research pursuits. And I kind of resolved that by just moving between them, actually, as freely as I could, and as freely as I was able to when opportunities came along. Soon after my doctorate in clinical psychology, I embarked on a part-time PhD. I didn't complete it, but I did the MPhil part of it. And that was a conflict resolution, you know, MPhil that would have led on to a PhD. But I was just doing that, you know, in my spare time. I was just working clinically 4 days a week at that point. Something that I've sometimes done actually is to shorten my week just to pursue other interests, and that was something I combined with those early clinical jobs, was doing a master's in conflict resolution, which was a great subject to just immerse yourself in. It was the early noughties. Lots was happening in the world, and it was a great course with great fellow students. Also, you know, there in that place at that time. I met my wife there as well, but that's another story. I then took other clinical jobs, focused mainly on clinical things, and then an opportunity came along again to do a research fellowship at a prestigious neurological hospital in Putney. So I took that for 3 years, and then I've worked 10 years in the civil service prior to the Berkshire job, which was a very clinically demanding role, full-time in the civil service, attached to a military mental health unit as well in Aldershot. That was my main locality, if you like. And now I'm with Berkshire in more of a manager's role, to be honest. I see very few clients actually in terms of direct patient work. So that's one of the, I guess, misconceptions that people may have, I guess, that, you know, that we see clients, patients back to back in direct work, face-to-face work. It really depends what your focus is and what your interest is and what the role is. It's not always like that. You can, if you like, find your own balance. I do some private work as well. You know, on the 1 day a week, I'm not working for Berkshire. I'm again working 4 days. So 1 day a week, I'll do some private work, and that's mainly in rehab and neurology, building on that academic clinical interest. But I do some other work as well. It's got a kind of occupational health feel to it, actually, that work. So that was really the path or the journey. Just to say a few things about what we as psychologists working in health do. I think we're problem solvers. Basically, that's how I think about it. And that's whatever, you know, if you like, orientation or model you're using. I think we're problem solvers. Of course, the problem is, however, not necessarily a practical one. It tends to be bound up in the life story of an individual, their identity even. And because of this, you know, if we're going through a difficult time as humans, it's very hard to actually see the problem, see it for what it is, and have a certain kind of objectivity or third-party perspective, which you need, I think, really to move on and to recover often. So typically, individuals who are going through a difficult time, you know, they often need the help of somebody else to walk the path with them, to be encouraged to believe they can change. So I think that kind of stretches really across a lot of the roles we might work in when it comes to working with clients, and depending on whatever training we have. As clinical psychologists and as psychologists, I think we still use quite a lot of jargon. You know, that is quite, you know, it's there every day. We use diagnostic terms, however much we might dislike them, you know, and it's hard not to use those terms just to have discussions with colleagues, even though at the end of the day we're talking about an individual with thoughts, feelings, dreams, wishes. We talk about treatment pathways, capacity and consent, functionality, primary and secondary problems, syndromes. You know, this is the jargon of what we do. What I really enjoy when I do clinical work is that, well, and actually even in the manager's role is knowing that we're making a difference to people's lives, getting the right kind of help to the right people, and the more we can do of that, the better. You know, whatever your role. And that gives me the job satisfaction. I find it very hard to accept, as we sometimes have to, that we might not have the right kind of help and might have to turn people away from services. But occasionally, and with a heavy heart, we have to do this for various reasons. Maybe the service providers feel they've exhausted all possibilities. There's been episode of care after episode of care, and the patient isn't recovering. Or maybe it's a problem area that's just very complex, and the NHS is not very skilled up to treat that if you like, constellation of issues. These days, we try and do that in a kind of team approach. So if we're giving that message to a client or a GP, we try and get all the clinicians who know the client or who have known the client around the table, all the stakeholders, and it's about making an informed, clinical decision, basically, and doing that in the best way possible, and then being very clear in our communications with the referrer and with the client. As a senior clinical psychologist, I've had a lot of choice, control, autonomy over my career, but I've also looked for that, I think. As I say, it included a 3-year research fellowship, and then 10 years in the civil service, and then back into the NHS. Aileen, you asked us to think about misconceptions in advance of this. There's lots of them. I think one of them is that you finish your training. My experience is that you never kind of finish your training, actually, I'm sorry to say. And the best psychologists, therapists really continue their training and development, and it's just an ongoing thing. There's new approaches, there's new things to learn coming out all the time. You're in the process of trying to reinvent yourself, and it's really a lifelong pursuit. So you have to enjoy it. Yeah, you have to enjoy the journey for what it is. If we think back about what's changed in the last 10, 20, 30, 50 years, there's such huge changes going on, I think, in mental health care. So, you have to kind of go with that if at all possible. I suppose another kind of misconception might be that there's, that you're looking for a kind of like simple solution, cause or solution to issues of mental health. I mean, we as psychologists, we've long argued against simplistic thinking, lazy thinking, if you like, and that's a tradition. You want to continue, really. I mean, that's what we've always done. We have to continue fighting against that lazy thinking, if you like. And I would include some of the kind of diagnostic thinking as lazy thinking. Another is, I guess, that we're rational scientists, merely applying our knowledge. I mean, when I was applying for the clinical course, you had to put scientist practitioner at some point in your additional information section, and expand a little bit on that in the 3 lines you had, and then talk a lot about it at the interview. But, I guess it's a bit of a game. You're a scientist and you're a reflective practitioner. It's a craft. You're trying to learn as much as be au fait with the research. In terms of highlights, one highlight has been my involvement in a trial in Aldershot, and that was when I was attached to the military unit. We were facilitating mindfulness groups for sick and wounded serving soldiers. I trained in MBCT, mindfulness-based cognitive therapy. I did that between 2012 and 2014. And it was a bit of a slow one to get going, to start using that in the clinical setting, but we got there. It was a bit of a slog. It started out mainly, I was mainly applying it to, if you like, in a staff support role, but then we started doing some really quite innovative things with serving soldiers who, had been attending the clinic for many years and who had really suffered in their duty, and many had given up hope that traditional or conventional forms of treatment could help them. They were kind of at an impasse. And we didn't exclude anyone based on diagnosis. These were soldiers, who hadn't recovered with treatment as usual, what they had in common was that they hadn't recovered. It wasn't their diagnosis. And interestingly now, you know, an email came in to my inbox a couple of months ago, you know, mindfulness trial, you know, principal investigator approaching talking therapies, and what they want is to give mindfulness to people who haven't recovered following a, you know, course of treatment as usual. So a similar kind of idea, really. And actually, that's what I find really fascinating about research and innovation, is that the ideas are kind of out there, and many people are having the same ideas at roughly the same time. It's a bit of a race to get that first publication. Nobody really owns the process, and nobody really owns the idea, to be honest. But you know, we're all kind of in it and thinking similar things in many cases. And particularly when I was working in that networking role, research role in the neurology hospital, you know, that's what I came across. Many people doing similar things in different parts of the country, having similar ideas. What led me to the career, if I could talk a little bit about that, is that I suppose, I mean, one thing is that I think the interaction between your personality and your cultural background, I think, is an important influence for me. I was once told I had the right kind of temperament to be a psychologist, which was actually really nice to hear, because it came from somebody who I really trusted and respected, professionally, philosophically. He was a family friend. That was nice to hear that, because I was heavily invested in it at that point. So, and I'm also very grateful to psychology as a discipline. My mum's German, my dad was from Wales. You know, they got married in the 60s, faced all kinds of, I guess, barriers, you know. So I have my own kind of, if you like, dual heritage background, and now I've married a Danish wife as well. You know, we're literally supporting 4 teams in the Euro 2020 competition. There's 4 languages to learn, you know. But psychology, you know, I'm grateful. It's given me the space, the tools, the inclination to really embrace my own diversity. And that's become more and more important over the years. You know, being a unique individual, knowing at quite a deep level through many and repeated experiences, really, over the course of a lifetime, knowing this, you know, that I am unique. And, you know, I mean, especially now, I really have very little to fear from standing apart from the crowd, which is actually a really nice place to get to, comfortable place to get to. I've always had quite a questioning, critical stance. That's been important to me. You know, and I think that interest in, you know, I still have that interest in research, even though I'm critical. And that's because of the urge to improve things always, really. I think we're trying to strive for that always. When I was doing research, yeah, go on, Aileen. I could talk and talk.
Sorry, Ceri, I'm trying to be a good chair here and keeping my eye on the clock ticking away. We do have questions for you here in the chat, but I'm just conscious that it is 5 o'clock now. So what I'm going to suggest is if we maybe just take a very quick one before we have a break. We have a request here from someone to shadow your work because they're very interested in becoming a psychologist and would like to find out a bit more about your really very interesting role, Ceri. Really do appreciate your sharing with us.
Please get in touch.
Yes, yes. Also, would you describe the difference in clinical approach between clinical and counselling psychologists in terms of how you would work with a patient group?
Okay, yeah. In terms of how you would work with a patient group, I think when it comes to working with patients, there's probably more commonalities than differences. But as was said earlier by Claire, I think, you know, it's a very different training actually in some ways, and it's structured very differently. Clinical psychologists do placements in the NHS. Counselling psychologists kind of find their own placements, find their own clients. And yeah, clinical psychologists, we work in, you know, we work across the lifespan. So children, older adults, people with disabilities, neurology, physical health. So we go and kind of work in all those different all those different areas. I suppose, I mean, a question I have is how much experience someone like a counselling psychologist might have of working with children. I guess that's one question I have. Maybe we'll get to discuss that a little bit later. But yeah, if it was an adult client, I mean, we all use the same models, I think. Clinical psychology courses do tend to be heavily orientated to cognitive behavioral therapy, for sure. Even so, many, you know, many clinical and counselling psychologists will go on and do a course like the diploma in CBT or the masters in CBT. But yeah, we get a lot of that really in the 3 years on the doctoral training.
Yeah, this is all fascinating. I'm going to propose that we take a short break now, so feel free to stretch, grab coffee, type in more questions for us. The break of just 5, we'll meet back at 5:10. We'll also come back and kick off with these questions before we move on to the more general panel discussion questions, because I think, you know, we're getting some excellent questions from the audience, which we would like to get to, and maybe have more than one person answer them as well from their particular perspective. Okay, so now we're going to start our break, and we'll be back at 5:10. Welcome back, everybody. So nice to see you back again. And let's just dive straight into the questions that came up from the audience, stemming from the session earlier. So, Dennis, if you could help me read out the most popular questions.
Yes, sure. Just let me have a look.
And if I could have panelists all ready to jump in with their 2 cents and their perspectives, that would be excellent.
So, for example, there is this question: from your international perspective, do you know how it is to work as a psychologist abroad if you have been trained in the UK?
So the question was about transference of UK qualifications overseas.
Yeah, I think so. Yeah, so training in the UK, yeah, working abroad.
I don't think there's automatic reciprocal acknowledgement of registration, but correct me if I'm wrong, panelists.
Absolutely. I've lived in Australia as well, and this wasn't a straightforward process. Every country has their own rules and regulations, so certain titles are protected in every country. So it is not an automatic process, and it's a really difficult process to get through. So if you are a world traveler, don't go for psychology. No, I'm just joking, but it's quite a lengthy process, to be honest, to get through that. And certain countries are, especially like Australia, has made it almost impossible now for foreign qualified psychologists, because they are requesting your degrees coming straight from their university. They would not accept copies of your certificates, which I don't think any university is going to do in the world. So it's a pretty difficult process to be.
Right. Yeah. Any other thoughts on that one, or shall we move on to the next question, Dennis?
Yeah, there is another. No, sorry, go ahead.
I was just going to say, I think in the last year, many therapists have moved online and are actually doing a lot of private work online. So, you know, things are changing. Watch this space.
Yeah, that's great. Another interesting question was about how does one remain motivated or positive in a role where you might be exposed to varying levels of emotions? So, for example, working with an individual with depression, mental health disorders, how do you keep motivated or positive?
We all have our ways of managing self-care. It's a big part of what you need to learn. Nobody really tells you kind of how to do it. You've got to find your own solution. Yeah, I mean, it's like, I think most therapists, most psychologists will have a few tricks up their sleeve and a few interests, whether it's meditation, exercising, yoga, tai chi. You know, it tends to be mind-body approaches. I think most of us have had a course of therapy at one point as well, when things got really bad. Yeah, you do what you need to do.
Any other thoughts on self-care, I guess? Anyone care to reveal a few tricks that they favor, perhaps? Just even in terms of how we all handle stresses in life.
I think that's a really good question, actually. I think as psychologists or people within the caring professions, we have a tendency to not look after our own mental health. And I always kind of am reminded of the analogy of putting on an oxygen mask and just keeping that principle in mind. You need to put on your own oxygen mask in order to be able to help somebody else to put on their own. So self-care is definitely very key. For me, that looks like journaling, that looks like going to therapy. Another thing about the counselling psychology course, as part of the course, you have to go to therapy. Each course will have their own specifications around what that looks like, but that is another course requirement that I forgot to mention, and I think it's also important to factor that into the cost as well, because that's obviously outside of what you're paying for in terms of the actual course. But therapy for me has been really beneficial. Journaling, running, and just having different outlets. So making sure that I also schedule my time, use diaries, use planners. Organizational skills are very important, and trying to avoid getting burnt out, particularly the millennial generation and Gen Zers. I know that there is this kind of idea of what they call grind culture, and it's really important that we sort of prioritize and look after ourselves and don't, run ourselves down into the ground, whatever that looks like for you.
Right, fabulous. Thank you, Fisayo. Yeah. Just looking at the questions here. Here's an interesting one. What other career options are available if a psychology career, you don't end up with a psychology degree if you don't end up being a psychologist? Anyone want to put some thoughts there? I mean, I guess from my perspective, a lot of my own students have done a psychology degree, and they have done everything from working in actuarial science to human relations, I guess. And it's because of the breadth of training that psychology gives you, both in numerical skills as well as in reasoning and communication skills. So I think, that the world is still your oyster. I don't think it limits you. So I think that's why it's very hard to answer that question, but I'll just open the floor to our panelists in case they want to chip in here.
Hi Aileen, yes, I'd completely agree with you. I mean, I think it's, it's a really good degree, pretty much for a number of different jobs, and probably just a couple that spring to mind, might be around, marketing, public relations, advertising, some of those kind of roles. I think a psychology degree is quite helpful.
Fabulous. And for those who do want to go into psychology, and specifically clinical psychology, do you think there are certain traits, asks a member of the audience, that prepares one to be in clinical psychology?
Specific to clinical, I would say no, not really. But psychologist in health, yes, yeah, I think there are. Yeah, I think good listener, patient, flexible thinker, those kind of things, curious, inquisitive. Yeah, but that can be, yeah, and that can be, yeah, and that can be for, I would say, for whichever, applied path you go down. But
yeah, and this isn't necessarily a question here, but one thing that I've picked up from all your stories is that there are different twists in the road. You can go through a process, and you can step out, you can step in again, particularly in your story, Ceri, where you did a fellowship. So there's that research element alongside the clinical element. And now there's even sort of managerial leadership type roles as well. So I think if there's one thing I take away from all of this is that it is a journey, and that it is important to enjoy the different phases and different stages of that journey. And I guess to always keep that sense of curiosity and that sense of openness and being true to yourself as well. Would you agree with that, guys? I'm seeing nods. I know that we can't see all of our faces at the same time, but I'm seeing nods. Yes, I'm just going to ask our panels about how you and your team might care for those from marginalized communities. So how does caring within your profession respect individual differences and embrace inclusion? So one of the earlier submitted questions we had from our audience went along the lines of, I'm interested in knowing the options open to a mature BAME male in professional psychology practice. So if you could say something about diversity and inclusion from your experience, that'd be great.
Sorry, I was that's a very good question. I've recently accepted equality diversity lead position on a doctorate of clinical psychology course, and of course equality and diversity is very important, especially in psychology, as we've observed in England. And HEE has recently started a RISE mentoring project for all the mental health professionals working within NHS who are coming from BAME community to support their career.
Right, we seem to have lost Fisayo, Mallika there, but maybe we can go to Fisayo, who also had a hand up.
Sorry, you're on mute, Fisayo.
You're muted.
Thank you. The classic line. One of the things I wanted to mention is that there's a lot of encouragement from the courses for more diversity within professional psychology. So that includes a lot of the underrepresented populations, so including men, including people from BAME populations, including the LGBTQ community. So I think that as a whole, psychology is recognising that actually in terms of progression and in terms of longevity of the profession. We need to have diversity of thought, diversity within the body, or we'll all become very similar. We'll all sort of think in the same way, and I guess that can be quite limiting for the field, you know, if it wants to progress, particularly within these current economic COVID times, and to progress as a profession. I mean, psychology does have a long history, and it is obviously mainly within the academic setting, but now it is being utilised within clinical practice, and I'm very much keen on sort of getting as many people within that from marginalised communities to sort of apply to psychology courses, or to kind of engage, you know, in this kind of way. And I'm very much about promoting that plurality, promoting that diversity of thought. And from a University of East London, where I'm currently training, they do have a social inclusion agenda, I guess is what I probably would describe it as, and they're very much active in terms of refugees, migrant communities, and looking at social change. So I think there's lots of, I think one thing I would suggest for people if you're applying to courses is also to think about the ethos, the value system that the courses that you're applying to have, what type of approach they use. Is it more of a medicalized model? Is it more of a social constructivist model? How do they see, how do they understand distress? How do they understand mental health? And I think that's something to kind of probably bear in mind, is probably what I would say. But there is definitely an agenda within psychology to sort of increase plurality, and I think that's definitely a good thing.
Okay, that's great. Now I've got just one last question for the panel before it looks like we have to draw to a close. So just looking at the next 10 years, what do you see the changes that might arise in your field and in your role of work? Maybe if we could start back to front from Ceri and move forward.
I think COVID is having a dramatic impact on everyone's lives, and I don't know whether it's just speeding up something that was happening in any case, but yeah, 2020, not just COVID, other events, Black Lives Matters. You know, what I'm noticing is that the younger generation, they have a mental health literacy that we didn't have, our generation, and they've got diversity and inclusion as core values, and their passion is really quite infectious, and I see this as really great, you know, really encouraging, reassuring development. Yep.
Fisayo, any words there from your perspective?
I would say that the psychology is definitely changing, and the face of psychology is definitely changing. It feels like it's changing, and with services moving online, that has sort of maybe sped up something that was going to happen potentially inevitably. My current research topic is actually looking at the therapeutic alliance that's developed online, and I do believe that digital therapy potentially is going to be the way forward. And what that potentially means is that as psychologists, we need to learn to adapt to this changing world and be able to work in a different kind of way. Because I reckon my thoughts are potentially that chatbots, digitalized ways of working, using online platforms will become much more the norm. And I know there's a lot of resistance to change. I know when I was working in some services, there was a bit of resistance to change, but we've been forced to change due to COVID. So I think that that psychology will always be needed, always, but what it might look like in the future might be different to what we had, the traditional services that we had in place beforehand. That's what I'll say.
Lovely. Claire, what about your thoughts?
Yeah, we're just reflecting on a couple of papers I think that were published last year, collaborative papers, among psychologists and other professionals. Really just thinking that the pandemic is an opportunity to improve mental health care for everyone now. And really, I think it's highlighted the inequalities. So really, just as Ceri and Fisayo have said, really focusing in on how we can actually tackle inequalities. And sort of reaching out to isolated individuals, so more sort of like social support services, and revisiting sort of integration of social and healthcare, I think. And again, really just focusing in, capitalising on the gains that we've made in being able to work digitally in such a sort of unexpected way, in the way that everyone's really sort of taken to this. And obviously it has got some criticisms and some difficulties, but on the whole, I think it's, given the papers I've read and the views I've heard from other people as well, that on the whole it's worked well. And there, of course, there will always be areas where clinical need, where you need to obviously practice face to face. But I think trying to find sort of like a hybrid model, going forward and thinking about improving access and tackling inequalities will probably be the main areas going forward.
Thank you, Claire. And Mallika, your thoughts on the future?
It's one of those which has already been mentioned by another panelist here. Is the diversity equal? I can visualize the equal opportunities for all the students to be a psychologist when higher education of England is trying to provide as much mentoring schemes and as much support as they can. So that yes, there will be equal opportunities for all the students coming from diverse backgrounds. And lots of higher education institutes are also working on decolonization of the syllabus, which is very important. So that's something which will probably come up. It is hard to certainly change it all, but we can see that probably in the next few years things are going to get changed. Of course, as all of us understood with the pandemic, the importance of mental well-being. So in one way, of course, things are difficult to work online, but on the other hand, like my local service actually reached the full capacity during the pandemic when all of the sessions were attended. So that was good, that less NHS time was wasted by being online. So lots of good things are happening, and I suppose we can increase access to the services by being online. Lots of patients who cannot access during the working sort of time can access therapy outside the working time. So being online has increased opportunities. So as our course, we've got 80 students on one cohort coming from all sorts of different parts of England accessing the course. So I suppose there are lots of good things coming out of the pandemic, that things are going to get changed forever.
Brilliant. Right, we are at the end of our allocated time now, and I am forced to draw this event to a close. I'd like to thank all our wonderful panelists, our production team, Nick and Fran, and of course our awesome student partner team behind the scenes, and also thanks to all the audience as well for your engagement. If you are affiliated to us as a current or past student, please join us and continue the conversation on the LinkedIn group. I hope this session has been interesting and helpful to you wherever you are on your psychology career journey currently. Perhaps our paths may cross again in future, but regardless, I wish you well and all the very best for your future careers.